Rodney, the FDA approved a $5 rapid coronavirus test that doesn't require a special computer. This seems like the thing we've been waiting for. A story here from CBS News. The FDA on Wednesday authorized the first rapid coronavirus test that doesn't need any special computer equipment to get results. The 15-minute test from Abbott Laboratories will sell for just $5, giving it a competitive edge over similar tests that need to be popped into a small machine. And so this thing, Rodney, this looks like potentially the answer we have to maybe getting things a little bit back to normal if we could do this kind of rapid testing.
Yeah, you're right to a degree. And I believe the federal government's placed an order for like 150 million of them or something like that, if I have my numbers right. But it's going to help in a lot of places, but it takes 15 minutes, right?
Yeah.
15 minutes.
That's better than 5 days, isn't it?
It is better than 5 days. Are you going to wait 15 minutes to go in the restaurant?
Well, I don't know about that, but it could. Well, let's say
that's my point.
Well, all right. Well, what about school? All right, let's maybe get the big one out of
school is going to be the thing, right? Okay. You're going to be able to test everybody, and they're going to go into their room, and then you're going to know whether or not they have it.
Yeah.
And so there's going to be some places where it makes some sense.
Yeah.
Offices are going to make some sense. But the things that we do every day casually, going to malls and stores and stuff like that, nobody's going to want to wait.
You're just not going to go. I think that's a great point. You just be like, screw it. I'm not going to stand here like a jackass for 15 minutes. And then,
it's the old hand dryers when the first hand dryers came out and they took them forever to dry your hands. It only took like 45 seconds. But after 10, we're going, what? We're ready. We want to leave. So
what? It's true. So what are we? And then it ended up being exactly being used less than what its intent is. But I mean, what do you want? Like a 30-second test? What are you asking for here?
What I want is herd immunity. And so the end thing to understand about all this, which is what we keep talking about, it's a virus. Yeah. You don't beat I hear these lawmakers say, well, we need to beat this. You don't beat a virus. What you do is you get the virus. And then you have enough people get it to where it doesn't spread like it did before. You still get it from time to time, right? It mutates, whatever, but it doesn't go through the population as rapidly, so you don't cause a buildup in the healthcare system. We get influenza every year. We've never beat it. And that's so right. What I really want is for us to have enough people, which it looks like Sweden might be in that camp now, to where it slows down dramatically.
Well, Rodney, they told us 65, 70, 75% was required for herd immunity, and now that number is looking like it could be much, much lower, perhaps 25, 30% of the population. That seems to be tracking that way, doesn't it?
It does. I don't know the numbers on herd immunity, but I do know that they're not 70%, and so we'll see. But we need a couple of years of this. I mean, I don't think we're going to be having this conversation in 2022, and it won't be because of tests. It'll be because enough of us have it.
Yeah. Well, I would just say, though, it seems like New York State, I mean, is brutal. I mean, we know the nursing home story and all that. It does seem like New York State has got herd immunity, and by accidentally or intentionally having the virus work its way through the most vulnerable population. But at least they have kind of made it out the other side, and maybe there is hope that that this can happen for us.